So since I was a kid, I didn't have real good dental care. Didn't brush real well, didn't floss real well, and my teeth over time got real decayed. I got real bad gum disease, and quality of life wasn't real good. My teeth hurt all the time, cold sensitivity, stuff like that. Couldn't find a dentist that I really liked. Really was kind of not so much afraid, but didn't understand. And by the time it came time to get the work done, everybody made it seem very overwhelming to get it done. It was like, it's gonna be so much work, and it just became a big issue. And so I put it off until about 5 years ago. Started getting stuff fixed up and done and pretty and smiling. Anxious is probably a much better word. Real anxious about going to the dentist. I have a problem with people right in my general face vicinity. I have a personal bubble issue, and it's just hard for me to sit somewhere. Well, my mom recommended Dr. Davidian. She'd come here for a little tooth, and she said it was a nice place, and it was real close to where I worked, and I was like, okay, I'll check it out. Came up here, and the staff was real nice, and I love Jody to death. She's my hero behind the desk there, and Dr. Dan's really personable. Amanda, who typically does she's the hygienist, who typically does most of my stuff before Dr. Dan comes in. She's awesome. We love talking. It's just a nice place. I wouldn't go anywhere else. The last procedure I had done 2 weeks ago, I had gone under sedation. I was under from 7 o'clock in the morning until about 1 o'clock in the afternoon. I had 5 crowns put in and an extraction. It was fairly painless, and by fairly painless, I don't remember it. And my mouth didn't hurt when I was done. It was just nice. Sedation is the way to go. Yeah, in the last 2 years, I've noticed my quality of life, both health and just socially, improve. So 2 years ago, I had some work done as well here. I had a couple more crowns put in the back of my mouth and some more extractions done. And before, I didn't like smiling. I didn't like showing people my teeth. I was didn't like talking a whole lot, and I didn't look at people when I talked to them just in case they might see my teeth. Now I got a lot more eye contact. I have a lot more personal conversations with people that I don't know, just people I see on the street, because I don't mind looking at people now. I don't mind them looking at me. My wife loves it. She says I smile more. This past weekend was my birthday, and my mom said for the first time in about 25 years that she can remember, I got a gift, and I always smile for her, but I've always smiled with that closed lip smile. And this year was the first year that when I smiled, I gave her a real big teethy smile, and it made her happy too. And it's just nice to be able to do that for somebody else as well as for me. I'm more confident about it. So unlike most places, when you call and you set up an appointment for a lunch break, I'm gonna come up there during my lunch break, but I only get an hour. You come in, you're here for an hour and a half or 2 hours, but you tell them you're there for your lunch break, so you're not there all day. The first time I came in here, I said, hey, I'm only getting an hour for lunch, so I need to be in and out as soon as possible. I walked in the door, I walked back to the office, to the room, I sat down, they had all my x-ray stuff ready to go, they had everything laid out. I was in and out in about 50 minutes. I tried a couple dental practices before I came here, and the biggest thing about this place is that they know you. And it's nice to be able to come in and Jody behind the counter knows my name. I know her name because she's the only one I see, but she sees 200 or 300 of me. And it's nice to be able to walk in and she says, hey Jonathan, how you doing today? And it's nice to be able to get that conversation from her, and the girls in the back know my name, and Dr. Dan knows my name, and we can have conversations not about dentistry. While we're here, that's the major focus, but you also get to talk a little bit about personal. It relaxes you a little bit, and it seems more like a big family than a dental practice. I'd say that I'm not going to say that there's not a fear of the dentist, because I know a lot of people that have a fear, but I'm telling you, the best way that I've found to go to help me is to be sedated. It's nice, it's painless, it doesn't hurt at all, you don't have any groggy overtones. I mean, I went to work the next day. I came in for a surgery on Wednesday morning, and Thursday morning I was going back to work. So you had to take the whole day, but you don't remember it, it doesn't hurt. You don't have to worry about being anxious the entire time you're sitting there, or stressing out the day before. You come in, you get it done, you go home. I would not go anywhere else. I've been other places, I've talked to other people at other places, I tell people to come here. I love that Dr. Dan is personal. He knows you, he talks to you, and it's not all about being a dentist. I've been to dentists, which is one of the reasons I didn't like going when I was younger, was they don't care. They don't want to talk to you and see what's going on in your life. They just want to do their thing and get out. It's all about the money, it seems. And here it's not about that. It's about, talking to people and understanding who their clients are.